I appreciated the chairman highlighting this issue and the focus that he brought to it. Waivers are an essential tool for states, allowing them to tailor insurance programs to fit the needs of their patients. Across the country, states continue to prioritize flexibility and the use of innovative local solutions to expand coverage. Unfortunately, this desire for flexibility has met federal government roadblocks, and this is especially true for Idaho. As I mentioned with both of you privately when we talked, Idaho has tried numerous creative approaches to expand and coordinate coverage between certain individual market and Medicaid populations. Medicaid 1115 waivers grant important flexibilities for states to improve benefits and to try new ideas in their Medicaid programs. Obamacare's 1332 waivers allow states to implement policies that stabilize the market, lower insurance costs, and incent competition, provided, as Senator Wyden mentioned, that the guardrails are protected. Yet when states try to merge the two waivers to coordinate and expand coverage, they're met with rejection and disappointment from the federal government far too often. This appears to be a statutory problem in many cases that prevents novel approaches to creating more seamless, harmonized insurance markets for patients. Without solving this issue, states must deal with population churn, inconsistent benefits, budget uncertainty, and the inability to advance changes that would improve care. I realize you can't change the statutes, but I do believe that as much flexibility as possible to allow states to use these creative options should be utilized. And I just first want to ask, and I think you've already basically said this to Senator Wyden, but if confirmed, would you work with me and others interested in improving the 1115 and 1132 waiver coordination through statute? It's just a yes or no for each of you.
Yes. Yes.
And I appreciate that. And while this waiver work is underway, do you commit to incorporating state perspectives and expertise in CMS and HHS decision-making to ensure that local solutions to address coverage are included in your work?
Yes.
Yeah.
Yes.
Thank you. And finally on this, I'm deeply concerned by the current administration's approach to Medicaid waivers that were granted in the last administration. In other words, what will be the approach to waivers that have already been granted? While we should work to improve evaluations and processes for all waivers and demonstrations, the changes that have occurred this year on Medicaid waivers necessitate more immediate action. Ms. Brooks-LaSure, do you believe revoking approved Medicaid waivers or portions of approved Medicaid waivers immediately following an election sends the wrong message to the states?
Senator Crapo, thank you for raising the issue. And as I mentioned, I do a lot of work with states and understand how much they want certainty from the federal government. That's something, if confirmed, I will really work to make sure that states understand decisions and, as you said, are part of the decision making.
All right, thank you. And then